Psychiatry, science, and YouTube. Oh my. When someone is struggling with their mental health, it can feel very scary, frustrating, and lonely. However, and ironically, most of them are not completely alone. Those who care for them, family members, partners, friends, clinicians, we often struggle too, wanting to help, but usually in the dark as to what to do. But as a former teacher, I believe that knowledge is power. Better understanding our own struggles, or those of somebody we care about, is the whole point of this channel. I'm Dr. Vint Blackburn, and if you're interested in learning more about mental health, whether it's your own, or that of loved ones, or better serving patients and clients who struggle with their own mental health needs, then you've found the right place. One of the things I'm really fond of telling patients and their loved ones is, we think we are in charge of our brain. But in reality, it's in charge of us. By the way, if you're interested in why I believe that mental health and physical health are actually the same thing, and that the separation of the two is not only false, but frankly dangerous, well, you could start out with my video, Mental Health is Physical Health. I have a link to it up there somewhere. Or, if you're seeking better ways to communicate with somebody who's really upset, but you find that no matter what you do, it seems to make matters even worse, then check out Don't Tell Me to Calm Down at this link. But if you're interested as to how far I will go to engage curiosity and learning, then stick around because the end of the video should be of interest to you. Oh, subscribing and hitting the like button is something I'd love for you to do at any point. Now, I had a very interesting journey to psychiatry. I came to it relatively late in life at 41 years old, when I gave up teaching middle school and high school science in Santa Fe, and I went to medical school at the University of New Mexico. And before teaching, I had been a web developer, during its infancy actually, a graphic designer, a pilot, a photojournalist, a touring musician, and an audio engineer. So after 4 years of medical school and 4 years of residency, and then another year as a child adolescent fellow, I realized that I really wanted to incorporate and combine all of this disparate knowledge and experience. It's kind of funny, but I actually tell people, and I'm not completely kidding, that I learned more about being a psychiatrist as a middle school teacher than I ever did in medical school. I certainly witnessed a lot of struggles without knowing how to name them or fully understand what was going on with my young charges. But it also gave me a great insight into the normal development of kids during one of the roughest times in their lives. And I also think that it has really strengthened my ability to understand what adults go through, since so much of what plagues them now started much earlier than we realize. And as a science teacher, my job was to take sometimes inaccessible and complex ideas and make them interesting and comprehensible for my students. Now, if there is ever a challenge, it's taking the world of medicine and doing just that. But I find it extremely rewarding and fun to help people at all levels, from physicians who are not necessarily psychiatrists, trying to better understand and work with the struggles of their own patients, to families who desperately want to understand but don't their loved ones' sufferings, and of course to the patients themselves, who are often confused by their own actions, feelings, or beliefs. In most every case, understanding leads to improvement or at least some sense of solace. I currently do a lot of lecturing to medical students and psychiatric residents, but I find that some of the most important work I do is with patients and their families around psychoeducation. After all, I fully believe that the more we know, the more we're able to help ourselves and others achieve mental health. So what I hope to do in the coming months is to break open the world of mental health, reduce this ridiculous and stupid stigma around my mental specialty, empower patients and families and practitioners through knowledge, understanding, examples, and analogies. I will also be interviewing other practitioners in a series I hope to call Practicing Outside the Box. We're going to be talking about their pet theories, exploring their own journeys to becoming mental health practitioners, and getting their take on myths and misunderstandings surrounding mental health. I'll be offering unique ideas and approaches for other practitioners who may be looking for new ways to discuss topics with their own patients, while at the same time trying to keep it all interesting, relevant, and accessible to everybody. So, if this sounds interesting or useful, then please subscribe to this channel, press the notification bell so that you can get alerted when I post new content. Furthermore, I really encourage you to leave comments below the videos and let me know what was helpful or what you found confusing or bothersome. I will not be getting into specific treatment recommendations or offer individual advice, but I'd love to crack open some of the thoughts, myths, and ideas people have around mental health. Now, I mentioned at the beginning that if you stuck around, I would show you the lengths to which I would go to help make education interesting and fun. When I was teaching middle school in Santa Fe, they let me convert my science room into a spaceship-themed classroom. We raised about $7,000, and a high school senior named Zach Wiley and I spent the entire summertime building this high-tech teaching space. All I can tell you is that it was absolutely worth all the hours we put into it, just to see the reaction on the faces of my students when they came back for the school year. Now please, if you're interested in this material, subscribe down below, like these videos, and leave comments. And remember, physical health and mental health, they're the same thing. I'll see you in the next videos.